Hi, I'm Wendy Laborn, and we are here with the June NATS Wellness Web Chats. And today our topic is going to be reflux in singers specifically. I have with me Marci Rosenberg, who is a voice pathologist and singing voice specialist at the University of Michigan, with extensive background and history with working with singers and certainly working with singers with reflux. So welcome to the NATS Chat, Marci. How are you?
I'm fabulous, Wendy. Thank you for having me. Happy to be here to talk about this very important issue with singers.
Absolutely, absolutely. And Marci is my co-author on the book, The Vocal Athlete. So this is the other half of me. I think between both of us, we actually get tons and tons of singers who have reflux or silent reflux. I really would love for you to talk a little bit about the differences between what is GERD, what is LPRD. So if you could start in with that, I think that'd be a great place to start.
I actually think that's a great way to start, because a lot of patients who come into our clinic are confused about whether or not they have reflux, and a lot of times they think they definitely don't have it because they've never had heartburn. So the way I explain it to patients is fairly simply. GERD tends to be symptomatic sort of from here down, and often it takes a larger amount of acid to create that heartburn kind of feeling. And these tissues here are biologically designed to defend against acid and have a bit of a higher tolerance for acid. When an even smaller amount of acid gets up into this area, we then refer to that as an upper aerodigestive tract area, and that's when we tend to refer to that as laryngeal pharyngeal reflux. And it can take a very small amount of acid to wreak havoc up in that area specifically for a singer, and it might not be enough acid to create a symptom of heartburn. And sometimes GI doctors, gastroenterologists, don't get particularly excited about those smaller amounts of acid because sometimes they're not taking into account how that small amount of acid can actually impact a singer. It can be fairly significant. So the silent reflux tends to be, you're not having those overt, maybe you're not having the burping and the belching and horrible heartburn, but you could have a much smaller amount of acid that's coming up into this area, which could be creating some significant issues for you.
Right. So let's talk about what are some of those laryngeal symptoms of LPRD that you see most commonly in singers.
I think probably in terms of the biologic symptoms would be just a generalized inflammation of the mucosal tissue. Sometimes that can go all the way up into the nasal area and create a postnasal drip kind of a thing, even some sinus irritation, sore throat. A lot of times they'll complain about a lump in the throat, which can either be because of a spasm of that upper sphincter or just because of inflammation. And how that translates into problems with the voice would be the inflammation that you're going to have generally in the mucosal area is going to impact how that vocal fold vibrates. And anything that impacts how that vocal fold vibrates is going to impact how that singer is making sound. So a lot of times they complain to us that it's taking them a long time to warm up their voice. And voice fatigue is another issue that we see a lot because they're not vibrating efficiently, and therefore they don't have the endurance that they're used to having. There's often a loss of clarity, and really, frankly, it can manifest in all sorts of ways for singers. It can really be a problem.
So recapping there, so feeling of lump in the throat sometimes, and they can have some or all of these symptoms. Lump in the throat sensation, longer warm-up time, quicker vocal fatigue. I see loss of high frequency range a lot of times because it is stiff up there. That feeling of postnasal drip or feeling like they have to clear their throat all the time, but nothing really clears. They're not bringing mucus up. Would you say that's fairly consistent with what you see in your population also?
Absolutely. And then if they are clearing their throat because the brain is sending a signal that there's something there to be cleared away, then that throat clear in itself is also adding more irritation to the system, so they get stuck in a cycle.
Right. So a throat clear kind of begets a throat clear. The more you do it, the more you clear. The more you do it, the more you clear. So it ends up with a problem. So GERD-wise, if they have heartburn or symptoms of frequent belching, things like that, do they always have voice problems?
I don't think so. No.
Yeah,
Not always. Yeah, if it's not getting all the way up.
Yeah.
No.
It's only once they get past that upper esophageal sphincter that we get into problems. And just as an anatomy lesson, remembering that the windpipe or trachea share the same wall as the esophagus or your food pipe, but they're separate. So anything you eat or drink or drains does not go into your airway or your larynx. It goes into your esophagus or your food pipe. Just as a reminder, because we get that all the time, I think, and that's not actually physiologically how things happen. So now let's assume folks have reflux. And we do know that singers are more prone to reflux because of diaphragmatic breathing, we believe. I believe there was an article out by Saddleoff, and I am going to pull that article. I'll send it and try to post it. But I believe it was somewhere where in the range of 35% of professional classical singers may have a hiatal hernia. Now, whether that is actually due to their singing or their physiology, we don't know. But that's a fairly substantial number, potentially more than the general population, and it may be because of this. So now let's assume as a singer at some point, maybe because of diet, lifestyle, combination, stress, we have reflux. What can we do? Because there are a lot of cure-alls out there. What can we do to minimize acid reflux? Let's talk medications first. Let's talk maybe about the three classes of medications and the pros and cons before we get into maybe the herbal supplements and then some of the lifestyle things. So we'll sort of do it in that. So talk about classes of drugs.
Okay, so the three sort of big kind of medicines that I tend to talk about with patients are the antacids, the H2 blockers, and the proton pump inhibitors. So this is how I explain these three medicines to my patients. The proton pump inhibitor, so Nexium, the purple pill, that's an example of one. The omeprazole, there are all sorts of different names for it, but it's a proton pump inhibitor. That's a preventive. So think of a PPI, proton pump inhibitor, piece, preventive. So that's something that you have to take 30 to 45 minutes before your meal. And what it does is it blocks the acid-producing pumps from generating a significant amount of acid. So it has to be taken before you eat in order for it to be effective. And it's preventive, meaning it's going to shut down acid so that your body's not producing as much acid when you are eating. Mm-hmm. Another kind of a medicine that you can take is the H2 blocker. So it also blocks, it's an acid reducer, but it's up at the histamine level, so it's a little higher up on the chain versus the PPIs, which are functioning right in the stomach acids, the acid pumps that are in the stomach. The H2 blockers are a little bit higher up in the biological chain, and these can be taken at night before you go to bed. And a lot of times doctors will prescribe something like a Zantac, on 150 milligrams a day of a Zantac, just as an example, to complement a proton pump inhibitor if a proton pump inhibitor alone is not enough. In some patients, their doctor has them only taking something like a Zantac or a ranitidine. Then there's the antacid, and the antacid is what I call the oops. So the antacid is something that you take after the fact. So you just ended a big show, you're going to go out for your big dinner and have a glass of red wine, and now you've had an acid assault up in the throat area, and then that would be something like Gaviscon. Gaviscon happens to be the antacid that I like the best. The United Kingdom formulation, I don't know if you guys can see it, is a little bit different than the formulation that we have here in the United States. United Kingdom Gaviscon has the sodium alginate in it and a potassium bicarb that's a little different than the United States brand has. The United States formulation, I think, is quite effective, but I do think that the UK formulation has a little bit of bigger guns. It's quite expensive. This is 60 chewable tablets, and I got this on Amazon, and this bottle was about $35. So when I tend to use this, because I am a singer who has significant reflux, I tend to save this for when I really need it, and I use the normal Gaviscon that we can get at CVS as my antacid. So proton pump inhibitors, the preventive. The H2 blocker is sometimes taken to complement the proton pump inhibitor, and the antacid is the oops, I had the big meal, so you take that after the fact.
Yeah, and so I think that there's also been a lot of new literature out there on some of the negative things that go along with these proton pump inhibitors. And I actually maybe go the other direction than you, in that I will say, let's be most benign first. Let's start with an antacid and then move to an H2 blocker if that's not working, and then moving in the proton pump inhibitor, because there are so many potential negative side effects, I feel like, with these proton pump inhibitors, and we're seeing more and more, including dementia, stomach polyps, some other things that are bone density issues. And it tends to be the long-term use of these drugs, at least that's what the literature is showing. Some of them are fairly robust. What's your thinking on that? Because I've heard several ENTs now, NGIs, trying to get their patients off of these, but you need to not have esophageal cancer either. So like if you're none of this is meant to say go off your meds. Do not go off your meds without consulting your physician. Also, don't self-treat. If you don't actually know that you have reflux, don't go pick up some PPIs over the counter or tell your students to go do it because they're burping. That's not best practice. You really need to be careful because you're starting to change your body chemistry. So what's your 2 cents on those?
I actually agree with you. And obviously as speech pathologists, we don't put patients on medical regimens, and many of them already come to us already on a proton pump inhibitor because their primary care doc put them on it just because they had hoarseness. So we educate them a whole lot about the different medicines, and often I will ask them to revisit the risks and benefits of being on a PPI with either their general doctor, certainly with our laryngologists. If our laryngologists have put them on it, it's usually because they're seeing clear and overt laryngeal signs. But I do agree with you. Let's start with the least, let's be the least invasive and then move through. And some patients do require a more robust regimen than other people. For me, I just take Zantac. I take 150 milligrams once a day, and then I use antacids. I don't take proton pump inhibitors. But I do agree with you that you have to be not self-medicating. Certainly as voice teachers, we should not be telling students, oh, you're clearing your throat, you have reflux, go do a 2-week trial of over-the-counter. We know from our clinical practice that when it is appropriate for a patient to be on a proton pump inhibitor, often it's going to take several months of them being on that with compliant use. And that's the problem with these proton pumps, is that they really do have to be taken 30 minutes before the meal, and you cannot go on them and off them and on them and off them and on them and off them because you confuse your stomach, and your stomach is not sure whether is supposed to be producing acid or not, and you can actually get a rebound acid that can even be more than previously. So you really can't be self-medicating and messing around with PPIs, even though they're over the counter. So I do agree with you, and I do think that if it's something where someone's at risk for a Barrett's esophagus or something that might have a higher risk of evolving into precancerous type of a situation, they need to be in very close communication with their doctor and their GI doctor about what regimen is appropriate for them. And it's not the kind of thing with a PPI that you can just stop it or take it as needed. What I find about the proton pump inhibitors, Wendy, tell me if you agree, is that a lot of patients come in and they're misinformed about how to use them. A lot of times their doc has told them, their general doctor has said, oh, just take it at night before you go to bed, or they're modifying, well, I'm not having symptoms, so I'm not taking it, and they go off it and they go on it. And I think that's problematic.
I do, and I also find that a lot of people use that proton pump inhibitor to allow themselves the luxury of eating pasta and spaghetti. So I think this segues a little bit into the fact of why do we have reflux in the first place? A lot of times it is diet choices and lifestyle choices, meaning like eating late and laying down, as well as stress levels. So let's sort of break those down, because if you are on the medications, ultimate goal is to potentially get off the medications. Hopefully, if that's a possibility, because there are physiologic reasons for reflux, like a hiatal hernia, or that you've got a dysmotility issue where things aren't digesting like they should, and that's another discussion. But just from the standpoint of you can't just be on the drugs. You need to also be compliant with the diet that everybody hates. So let's talk about dietary guidelines for reflux. What do you recommend patients do and don't do? Because we give people a lot of lists of don't do this, don't do this, don't do this. What things can they have? What are okay things to eat?
So, you know, if we want to think about, you know, going back to our biology class, if we think about an acid to alkaline scale, and 7 is considered sort of neutral, and anything pH-wise above 7 is more alkaline, and anything below 7 becomes more acidic. So our stomach acid is somewhere like, you know, kind of pretty low, like maybe like around a 2-ish. Soda is around that same level. So when you drink soda, doesn't matter if it's diet, doesn't matter if it has caffeine in it, it has almost the same amount of acidity as the actual stomach acid itself. So when we talk about diet, I definitely say eliminate soda. Very rarely do I say absolutely 100% eliminate something, because I am one that tends to go more towards let's figure out what your body needs and work from a reasonable point there. But soda is one that I would just say axe it. Just don't drink it at all. The other things that are super acidic, and some of it's very obvious, tomato-y things that we all love are very acidic. Things that are have a lot of fat in them require more digestive acids to actually break down. So fried foods. Things that are super spicy are more acidic. So the things that tend to be less acidic are things that are a little bit more bland and don't have quite so much tartness, vinegar, dressings, tomato-y things. Certain nuts have an acidity to them. Chocolate can be a trigger for reflux. But you know, when I talk to patients and I say to them, what triggers me may not necessarily be the exact same thing that triggers you. So a lot of it is educating the patient to figure out what they really do need to be eliminating from their diet. Coffee obviously is a big one for a couple reasons. It has caffeine, but more importantly than the caffeine, even if you're drinking decaffeinated coffee, coffee is very acidic. So, you know, and I actually happen to be a big coffee drinker, as Wendy can attest. But I do have to make really careful choices about how much coffee I'm having and when I'm having it. And I'll tell you, if I'm performing or doing a show, that is actually something that I have to eliminate from my diet many weeks beforehand, because it just creates a little bit too much havoc for me with my reflux. What other dietary things, Wendy, am I missing? Wine and alcohol, obviously a big one.
So I tell people that what they can have from a meat perspective, if they eat meat, is baked, grilled, or broiled protein. Mm-hmm. Yeah. So if you want a hamburger, make it at home yourself and grill it. Don't buy it at a fast food joint. Yeah. You can have fruits that are non-citrus. So your melons, your berries, apples, pears, bananas, grapes. I reflux really badly on bananas. I think probably some people have food sensitivities that make them reflux that aren't food allergies, which is likely what a banana is in my world. But not everybody has that. But that should be a safe food to eat. Right. You can have pretty much any cooked or raw vegetables, with the exception of onions and peppers. Those always need to be cooked if you're going to eat them and you have reflux, and I would keep those at a minimum. Yeah. You know, there are the lower acid tomatoes, the yellow tomatoes. Again, I'm probably really more of a stickler with my patients. I say go complete elimination on those things for 3 months, because we can add things back in, but if you're taking a very substantial drug to try to eliminate reflux and we want to get rid of it, and you've come this far to see me, or you've come in to take care of the problem, I want you to commit to doing this for 3 months. You can do this for 12 weeks, and then we can add it back in. So I do say no soda, no coffee, no alcohol for 3 months, no chocolate, and no tomatoes. Those are probably the biggest. And not eating late at night and laying down. So lifestyle-wise, 3 to 4 hours after you eat. And also maybe not bending over. And it can be bending over to fold laundry, bending over to put dishes in the dishwasher. Anything you do too soon after you eat, we've all had that sensation where you burp up and it's more than a little bit of air. So,
and I want to just add to that behavioral component is that it doesn't actually matter, even if you're on and need to be on and your doctor has determined that you need to be on big gun proton pump inhibitors. So all that does is change, we have to explain to our patients because they often don't quite understand, is it just changes the acidic content. You're still refluxing. It's just not as acidic. So it doesn't eliminate the actual biomechanical backflow of stuff that comes up. It's just not as acidic. And we do have studies that show that even that content that's less acidic because of medications can still create inflammation and irritation. And so if you are a singer, anything that's creating even a micro amount of irritation is going to be problematic. So you can't say, oh, well, I just take H2 blockers and PPIs and antacids so that I can have pizza every night after the show. It's just simply not going to work. So those behavioral things that Wendy just started talking about are critical, actually. And the not eating 3 to 4 hours, 4 hours is better before going to bed. Sometimes patients actually elevate their bed 6 to 8 inches. The pillows, to me, if you're going to get a reflux pillow, which is sort of a big wedge, it has to be longer than your torso, and a lot of them are not long enough. If you're just stacking pillows up, like my husband does, all that does is it tends to just crunch you over like that at night, putting actually more pressure on the valve and creating actually even more of a problem. So I tell patients, go to Bed Bath & Beyond, buy the bed elevators. They look like horse hooves, and you can stack them up and you stick them under the posts of your bed so that your head, you want your larynx higher than your stomach is basically the idea behind that. So that gravity is your friend at night when you're sleeping. Contents that might be sneaking up at night and bathing your larynx are going to be more likely to stay in your stomach. I think it was Dr. Jamie Kaufman, who's a laryngologist in New York, and she's probably made her career out of reflux and talking about reflux. And I believe she was one who, in a presentation, made a comment that it only takes 1 acid assault per week to keep your mucosal tissue in an irritated state. And that actually makes sense to me. And I can tell you, as a singer with reflux, I do understand that's why reflux is it can be such a problem for singers, because you really have to be disciplined and you really have to be diligent about managing it. Even if you're not managing it with hardcore medications and you're doing the behavioral things and the antacids, you still have to be quite diligent about it.
Right. So now we have the category where the singers would love to self-treat sometimes. We have all kinds of patients. I don't want to just say singers. So they come in with their regimens of apple cider vinegar, papaya enzymes, digestive enzymes, those types of things. Let's talk a little bit about efficacy studies that we know of, because there's this whole chapter that we talk about myths and truths.
That's right.
When we look up apple cider vinegar, because I can tell you that's probably one of the bigger ones that I hear people come in with. Tell me about that. In fact, I'm going to grab one. I'm going to grab some off my counter right now just to show you what I'm talking about.
Yeah. And I have
just one of the apple cider vinegar bottles here, and apparently it will cure almost everything from like gout to cancer. So talk to me about what you know about apple cider vinegar as a treatment for reflux.
So there's a lot of talk about it, and I have a lot of patients who come in saying that they're using that. But the reality is that apple cider vinegar is acid. So unless you're one of those more rare situations where you have no production of acid, and we do have patients who have that, that would be a discussion with a physician to talk about how to manage that situation. But the apple cider vinegar, and in fact, there is a study that shows signs of esophageal erosion with too much apple cider vinegar. So you have to be very careful with these herbal things that seem like they're innocuous. You really can create problems.
And what I would say is, again, if you have too much acid, that's a problem. Again, going on that pH scale, if you have too much base, that's a problem.
Right.
Again, your comment is to those patients that have too much base, adding some acid may help. But I can tell you, our patient reflux is reflux. You're not going to know by how you feel whether you're too acid or too base. And the thing I would say about supplements and digestive enzymes, you need to talk with your physician about this, gastroenterologist. And if you are going to go down that path of alternative medical therapies, which I am not opposed to at all, we would want you to have an integrative medicine approach. You want to make sure that you're working with a medical doctor who is an integrative medicine specialist, who truly has both Eastern and Western medicine knowledge base, because you are otherwise creating a chemistry experiment in your kitchen, and in your body. Problem. Unless you're a chemist. I feel like, what is that show, Breaking Bad, right? So we don't want to do Breaking Bad for reflux in the kitchen.
Let's not use ourselves as an experimenter.
That's right.
The papaya enzyme is kind of an interesting one. I know that there are some people who do head and neck cancer, have head and neck cancer clinical populations, and will recommend that sometimes to their patients who have xerostomia or dry mouth because of radiation. Again, I don't know. We don't have a lot of big studies on that. I mean, if something like a papaya enzyme is somehow stimulating saliva, well, so does chewing gum. And if it's not a heavy minty gum, it's not a heavy, because sometimes we tell patients to avoid things like heavy, strong mints. Arm & Hammer actually has a bicarbonate gum. So that is actually something that I do. Patients tell me that they find helpful. In my opinion, something like that is not going to be particularly harmful. But when you start using herbs and we don't really know exactly the impact, you're potentially going down a road of creating problems, specifically if you're on other medications for other things. Remember, some of these herbs have adverse reactions chemically with other medications. So,
all right. So let's assume now you're a singer. You've already recommended all of this, but they're on tour or they're in a show and they go out to their cast party. They eat or drink too much. They go to bed. They reflux, and they have a show the next day. Is there, in your opinion, any kind of quick fix? Or what can they do if they've got morning reflux? Like, how are they going to get on stage? So the nitty-gritty of what do you do if this happens?
Yeah, I mean, so this is one of the times when I would be popping the antacids after I had that meal to try to help minimize some of the the penance that I'm going to pay the next day with the reflux, making sure that I am elevated. And then when you wake up that next morning and your voice is fuzzy and the pitch is a little lower and you can tell you're a little bit hoarse, that's when I would then start kicking in some of our favorite semi-occluded vocal tract exercises like the straw in the water, the hum, Katie Bertolini.
Moving, vibrating.
Yes, so there's a nice study done by Dr. Kitty Vetterlini and I think it was Clark Rosen, where they looked at some of this gentle semi-occluded vocal tract exercises, and the hum is actually what they used. And without going into details about the study, one of the findings from this pilot study was that if we can gently mobilize the vocal fold tissue mucosa and get these nice waves going, that potentially is triggering a healing cascade and potentially reducing inflammation. So that would definitely be something that I would recommend. It's what I would be doing if it were me, and I'm trying to undo what I had done the night before. But really, if you're a professional singer and somebody's paying you to be performing, you shouldn't be doing that. You shouldn't be going out for the show after and drinking, and you're being paid to do a job, and you need to be able to do your job. I would say the semi-occluded vocal tract exercises, any of those types of things, making sure you're really well hydrated. Sometimes a personal nebulizer can help to just introduce some amount of hydration into the larynx, definitely much more so than a personal steamer is going to do. What do you have? What are your extra tricks that you tell
I mean, unfortunately, I don't think there's a quick fix. I do think that you get
really not.
You've got to kind of get it moving. I just was curious because I think that's a question I get a lot. I get that urgent call of, oh my gosh, I've reflux. What can I do? And my answer is, well, it should have probably happened last night. There's not a lot. I mean, we can get you moving a little bit, but it's probably going to take a few days to get you back to where you were comfortably. But I thought I'd throw that out there, the question. And then sort of to wrap things up a little bit, because this is a lot of information and we may need to do a part 2, because if we get feedback and singers have questions, please feel free to email us at nats.org, and we'll take that into consideration as we do more of these health blogs to really take your questions and get the answers that you want through evidence-based practice. But through your experiences, Marci, as a singer and as a clinician, are there any other pieces of information or tidbits you would offer to singers who experience and struggle with reflux?
You know, it's, to be perfectly honest, it's a bummer to have reflux, significant reflux, when you're a singer, because it requires a lot of diligence. And when you let up a little because your run of show is over or you're on vacation and you slip back into old habits, you are going to pay a price. And going back to that original statement from Dr. Kaufman that, you know, it really just takes one assault in a period of a week to sort of re-agitate those tissues. I really do think it's a lifestyle change that just has to take place. There are all sorts of resources. Dr. Kaufman actually has a book entitled Dropping Acid, and I believe there's a cookbook that goes along with it. But it's just sort of learning what your body needs to manage this issue as a professional singer. So like Wendy, bananas don't bother me at all, and I have significant reflux. For you obviously understand that for your body, you can't be eating bananas. So a lot of this to me is educating you about what your body needs and your body requires to be healthy. Some people drink the alkaline water, you know, the Evermore 8.8 alkaline water, because they think that that's, you know, helpful and is going to try to help, you know, neutralize the acid in the stomach. Again, I think that whenever we're messing with chemistry, these are conversations to have with our physicians. Right. We would think, well, you know, it's just water. How harmful could it be? And maybe that's true. But if you're having 60 gallons of alkaline water in a day, I don't know that we really know how that impacts the body. So making intelligent choices, having conversations with your physicians, and if you're a professional singer, you absolutely need to have a laryngologist who is on your team. So figure out who those doctors are in your area where you live and establish relationships with them so that you can be working with them to help figure out what you need to manage your reflux in as safe a way as possible.
Yeah, I agree with all of those things. And, you know, I think the only other thing I might add to this, and this is probably a discussion at a later point, is surgery an option from the standpoint of if you have a reflux problem that has a hiatal hernia or something like that, there's things that they can do to fix these now. And that may be a physician conversation that we'll have at some point, because it's not my area of expertise, but I think it would be something singers might be interested in instead of being on these meds, because sometimes you actually can't get off of them or you're really in trouble and you can't perform. So we then have to think about how do we fix the problem, because those solutions sometimes exist. The only other thing we didn't talk about that I forgot we hear a lot about is aloe vera juice. And aloe vera is used for burns. I mean, that's what aloe is used for. So the idea is that aloe vera juice may heal some esophageal burns. Again, I don't know that we have great information one way or another on that. However, it's something that we consider. It is also a laxative, so you want to make sure you don't drink the aloe vera juice without knowing what's going to happen after you drink the aloe vera juice. So just have an awareness of that. Anything else you want to add before we wrap it up?
No, I think that, you know, the problem with reflux is that there is so much information on the internet. Like a lot of the issues we deal with our patients who come in, and singers in particular, because we're singers, so we get very scared when we think something's wrong, and we do tons and tons of research. I would say if you're reading up on things online, make sure that you are on reputable websites, and be careful about what you read and ask yourself, does this make sense? And take the information, the questions that you have to your laryngologists, to your GI doctors, to your speech pathologist, to try to get some real information about what you should be implementing, what you shouldn't be implementing. Don't try to self-treat. I think that's probably the biggest. We wouldn't be self-treating blood pressure, right?
Absolutely. Or broken leg and other things.
I mean, a broken leg or a broken bone. So reflux has to fall into that same category, and particularly if you are a singer.
And if you're young. Because I see so many young, healthy people. And then, yes, absolutely. Right. We can go on and on about reflux.
Right.
But I wanted to touch on this iceberg so that our viewers and our watchers can ask us questions so we can further this discussion, maybe bring you back on to talk about some more of this as we get some questions. So please feel free to email us. You can reach us at nats.org, and also take a look at all the goings on at nats.org. I appreciate your time, and thank you, Marci, so much for your expertise related to on vocal wellness. And I will see you in July when we start talking about pyrotechnics and the voice.
Ooh, sounds good.